There can be no doubt that the federal government tomorrow, Josh Frydenberg, Scott Morrison and the budget are under the pump on the issue of aged care. We've seen the catastrophic consequences of coronavirus on the aged care sector. Even though the Prime Minister warned on March 15 this year when talking about the virus, quote, for the majority, around 8 in 10, it'll be a mild illness and it will pass. However, for older Australians and those who are more vulnerable, it's a far more serious virus, and that is our concern. Our aim in all of this is to protect the most vulnerable, the most at risk. Well, that hasn't happened. Counsel assisting the Aged Care Royal Commission, Peter Rozen, said in August there was no national coordinated plan to help the aged care sector deal with COVID-19. From day one, we knew the elderly were at risk. Which political leader yesterday or tomorrow will put their hand up and utter the certain truth that the elderly and their families have been let down? Tony Abbott was Health Minister back in 2005. He provided a clear path in writing by which governments could successfully navigate their way through something like the coronavirus. All of that was ignored. The Aged Care Royal Commission found that neither the Commonwealth Department of Health nor the aged care regulator had any specific plan for the aged care sector. This is staggering in its incompetence and the betrayal of our elderly. Governments mouth cliches, don't they, about dignity in old age. Well, dignity was abandoned long ago. Every residential aged care facility to be accredited is expected to have infection controls in place. Yet across the aged care sector, there have been failures in clinical care, infection control, which failures have resulted in hundreds of deaths. A whole stack of these aged care outfits, where Australian families pay handsomely, were warned about infection control. The numbers are big. There are currently 189,000 residents in 2,695 aged care homes on any day. And these residents are supported by approximately 1 million immediate family members. The homes are operated by 873 aged care providers, ranging from listed public companies to a single facility small business. The industry employs over 300,000 employees, predominantly female and qualified at a certificate level. Many families have paid hundreds of thousands of dollars to gain access to one of these aged care homes. Many have sold their own homes or other assets. Put bluntly, what have they bought? Death for their loved ones. If the Prime Minister said on March 15, our aim in all of this is to protect the most vulnerable, well, this didn't happen. Counsel assisting the Royal Commission, Peter Rozen, said neither the Commonwealth Department of Health nor the Aged Care Regulator developed COVID-19 plans specifically for the aged care sector. Well, as a result, there have been more than 660 coronavirus deaths, and the Aged Care Royal Commission, in its interim report released last week, criticised, quote, deplorable infection control regimes at some nursing homes. It found a, quote, traumatised workforce and recommended, now remember the budget is tomorrow, an urgent funding injection. Well, Professor John Pollaers was the inaugural head of the Federal Aged Care Workforce Strategy Task Force in 2017, the government's own experts. And they've warned the government that they need an extra $3.5 billion a year to provide adequate care. And even that, it's argued, is at the low end of what is needed. A report on staffing levels commissioned by the Aged Care Royal Commission found 57.6% of residents are in homes with staffing that would rate only 1 or 2 stars. Last Thursday's interim report identified, quote, confused and inconsistent messaging. All too often providers, care recipients and their families and health workers, it said, did not have an answer to the critical question, who is in charge? The report said existing restrictions had, quote, tragic, irreparable and lasting effects, which must be immediately addressed. Well, I note the Aged Care Minister, Richard Colbeck, has said the government is providing an extra $40.6 million for the sector. But the government's own experts have warned the sector needs an extra $3.5 billion a year to provide adequate care. And to add to a calamitous picture, only last month the advocacy group, and I mean, we've all got people involved here, we're all going to be involved in this, our parents and everyone, talked about the aged care crisis and said this: aged care residents in nursing homes have been raped, robbed, bathed in kerosene, attacked by rodents, suffered injuries or deaths from other residents, burnt to death, strangled, cooked, melted, sedated to death, over-medicated or choked to death. Someone in government better understand this is beyond a crisis. It is a scandal. What we have today, forget the rhetoric, is a simple and straightforward abandonment of the elderly. The decency of our society can only be measured by our treatment of those who most need our help. In relation to the aged, we've got to stop running away from the fact that we failed abominably. And if government fails, and it gets its chance tomorrow, such failure won't be tolerated by the electorate.